Hello, I'm Dr. Allison Steinhauser. I'm a clinical psychologist and heart transplant recipient, and I'm here to talk to you about becoming emotionally and psychologically prepared for a transplant. There are several steps you can take to prepare yourself for the transplant journey. Step 1. It's important to be an active member of your treatment team. Get involved, ask questions, be proactive in your doctor's appointments, and gather as much information as you can from the medical team, including medical information about the transplant before care, surgical procedure, and aftercare. Ask your doctors what you can expect during each and every step along the way. It's a very good idea to bring a family member or friend to as many appointments as you can. A lot of information is discussed, and having an additional set of ears to listen and take notes can be very helpful. And don't forget your pen and paper. Keep a notebook of all medical information so all of your questions and answers are in one convenient place. You can also make good use of the long wait times during your appointments to review your notes and questions. Research shows that we remember things better when we write them down. While in the waiting areas, talk to other recipients. Talking to other recipients and families is an excellent way to gather insight into the transplant process. Other patients and caregivers have walked a similar, yet different path, and the connections with other transplant families can help you get through this tough time. Step 2. Gather your support team. Once listed for a transplant, it's important that you identify family or friends to support you through the transplant journey. Your transplant team should include individuals you trust and people you can rely on and communicate well with. They could be family members, friends, community leaders, religious leaders, mentors, or coaches. Also, remember to keep a list of their numbers with you, as sometimes it can be difficult to remember them all. At least one person should be elected your point person. When choosing your point person, reliability counts. Your point person should have a plan similar to yours for what to do when that phone call comes that your transplant will take place. Your point person should know where to go and who to call in any emergency situation. This will also help to take some pressure off of you. It's also important to share with your support team that their role will continue after the surgery. You may need some help with transportation for up to 6 weeks after surgery, and you may need help getting around and doing some normal daily activities. And step 3, take time to prepare your body and your mind for the journey ahead. This starts with asking yourself, what changes can I start to make now that will help me be healthier in both my body and my mind? This is a good opportunity to put value and time into meditation, controlled deep breathing, and exercising as recommended by your primary medical team. It's also a good time to begin thinking about how your diet may need to change. The stronger you go into surgery, the stronger you'll come out. It's also essential to prepare yourself emotionally. There will be a roller coaster of emotions ahead of you, with some high points and some low ones. You can expect feelings of happiness and relief, as well as sadness and grief. All of these are normal and expected. If there's ever a point when these feelings become overwhelming, please contact a friend or a doctor and seek help immediately. Please remember, transplant can be a very challenging time, and there's no right or wrong way to feel. Reach out to your support team. You chose them because you can communicate with them easily. They're there to support you. During your journey, you may hear the term positive coping. Coping is the way we attempt to manage or overcome struggles, obstacles, or stresses in our lives. Positive coping is successfully reducing the stress and getting through obstacles in a positive way. During stressful times, we sometimes forget what our coping skills are. It's a good time to write down your strengths and coping skills when preparing for a transplant. Here are some examples of positive coping skills. Making self-care a priority, enforcing boundaries, exercising and eating healthy, problem solving, identifying your stressors, laughing, maintaining a daily routine, maintaining good sleep habits, good hygiene, recognizing when you might need some extra help from a professional. There are always people who can help you. Let's recap. Step 1, be an active member of your treatment team by asking questions and keeping a medical journal. Step 2, request the help of your supportive family and friends before, during, and after your transplant. And step 3, take whatever steps you can to prepare your body and your mind for the road ahead. Expect your emotions to fluctuate between the highs of excitement and gratitude and the lows of fear and grief. There's no right way to feel during this time. Thank you so much for listening. For more information or resources, please contact us.